So good afternoon, Dr. Dujiba. Hi. Thank you for
Hi,
coming.
Tiani.
Yeah, thank you for
Most
coming.
welcome. Thank you for the opportunity. Happy to share a few of my thoughts.
Thank you. So yeah, I think we have about few more minutes, so we can just until 2 p.m. I will show the video and then
Excellent.
then your time. It'll be your
All
time.
right. Okay,
Thank you.
excellent. Thanks.
Welcome, everyone, to the NUSAI Health Community. This initiative, brought to you by the Alice Lee Center for Nursing Studies, ALKINS, at the Yon Lu Line School of Medicine, National University of Singapore, NUS, is part of the NUSAI Community of Practice, NUSAI-CA. Our primary aim is to educate healthcare professionals on the application of artificial intelligence, AI, in healthcare. This project is funded by the NUS Center for Teaching, Learning, and Technology, CTLT, Teaching Enhancement Grants, TEG, FY 2023/2024. Within our learning community, we offer foundational AI knowledge and skills tailored specifically for healthcare professionals. We also promote collaboration and share AI-integrated teaching plans for healthcare education among local and international participants. Allow me to introduce the dedicated members of the NUSAI Health Community who contribute their expertise and enthusiasm towards leveraging AI for the betterment of healthcare. We also extend our gratitude to NUS Center for Teaching, Learning, and Technology, CTLT, for their invaluable contributions towards funding and publicity, which have been instrumental in making our community thrive. But that's not all. Brace yourselves for our monthly webinars featuring expert speakers delving into AI and its myriad applications in healthcare industry and education. Additionally, our platform serves as a hub for learning resources and event updates, ensuring you stay updated of all the latest developments. And if that's not enticing enough, our YouTube channel hosts a wealth of training courses focused on AI in the healthcare industry and education. Don't miss out on the opportunity to be part of this dynamic community. Subscribe to our channel at NUSA Health Community and visit our website to stay tuned for exciting updates on our upcoming events.
Hello, good afternoon. I just saw, happened to see some familiar faces. Okay. Hi, good afternoon, all respectable educator, researcher, and interested participant. Okay, thank you. I hope everyone can hear me. Okay, wonderful. Sure, thank you for joining me for the first public webinar for the NUSAI Health Community. I am Piani Yobash, and I'm an academic staff at Alice Lee Center for Nursing Study, National University of Singapore. It is my pleasure to serve as a moderator for the today webinar. Okay, please note that for today's session, it will be recorded, and the recorded video will be posted on our website the Instagram and also the YouTube channel. Okay. During the webinar, if you have any questions, you probably can place on the chat and we'll take a look at that and respond to you as soon as we can. Okay. Right. So for today's webinar, it's my privilege and honor to introduce our speaker, Dr. Dujiba Di Samara Sakera. He is a senior director of the Center of Medical Education at Yonglulin School of Medicine, National University of Singapore. Dr. Dujiba has involved in curriculum development, quality assurance, and accreditation, and faculty development at both undergrad and postgraduate level of health professional courses. He served in many international medical education organizations. He has published widely in peer-reviewed medical education journals as book chapters relating to medical and health professional educations. Today, he will deliver the webinar topic, Adaptive Learning for Diverse Learner Gamification. So please join me in welcoming Dr. Dujiba Samara Sakira. All right.
Thank you. Thank you, Piani, for that very kind introduction. Let me get quickly my set of slides here.
Wow.
Okay. Yeah, so yeah, that's the School of Medicine, the Vanda Orchid, the background. Yes. I'm really thankful and for this opportunity. But at the very beginning, I want to share two things. The first thing is that I'm not a game developer, right? However, my insights and my thoughts are coming from two angles. One, as an educator in health professions, and then secondly, from an accreditor or a evaluator perspective. My experience in gamification, the use of gamification, as well as adaptive learning technologies to enhance student learning, comes from my involvement with my colleagues here and also overseas in helping them to evaluate the program impact and evaluation, as well as myself wearing my hat as an external evaluator or a program accreditor, and then going to different places. So I'm happy to share that come this July also, I'll be going to a setting where they're using both online adaptive learning and also gamification to enhance the undergraduate medical students' learning as well. So that I need to share. And today we will be basically focusing on two main areas. And as an educator, as a faculty developer, what I call a people's developer, I hate giving lectures, all right, long didactic lectures. So this session, I have, Shravanti has kindly shared with me some of the questions that you have raised, and I have incorporated those questions also to our discussion. And this is going to be a very interactive one. So what I want you to do is that I'll be using Paul Levy because this is a conversation. I'll try as much as possible with the limitations of using Zoom to make it into a discussion and a conversation. And I'm sure most of the areas I may not know, right? So this is again an AI community. So as collectively, we will try to kind of, see who knows most or who have the relevant experience and try to get some solutions or answers to those questions. So please do copy this because we are going to have discussions, interactions throughout the next 2 hours or so. If anyone is finding it difficult, please do let us know. I can't see, but Shwanti and I think probably others can let me know. So you can unmute and Shoen, if you find that someone is having difficulty, do let me know. You can type in the Olivi, the site, or you can just scan it. Everyone is okay with this? All right, brilliant. Okay, so first of all, I know that this is open to everyone. Just want to get a little bit of from where you are. So,
Mm.
okay, excellent. We are from Australia. Oh, wow.
Okay. Wow, cool.
Someone
Cool.
from somewhere. Yes, most of you are from Singapore.
Whoa, whoa,
Spread across. Very
whoa.
interesting. Yeah.
Oh, some greeting from the UK. In the
Yes.
chat, there's some, yes,
So it's
participant
nice to
greeting.
see.
Yep.
For some of you, it is very early in the morning. Some of you very late in the afternoon.
Mm.
So it's great to have all of you. Okay, so we have about several of you. Okay, so I kind of get, where you are and where you're from. So that's great. Okay, just before we move on, as I also shared, can I get your thoughts on this? Okay, brilliant. Um, I'm we are seeing a wide spectrum of people who are interested and who wants to learn as well as share. And also there are already developers or educators who are using gamification. And then there's quite a number also who are planning to use gamification. I think that's really great because we can learn together and also share some of the things that others have discovered as well. So this is great. And I'm also very glad that there's no one here who's quite kind of confused and does not know why the person is here. If that is the case, we have a problem. So we don't have anyone here. So everyone here is really interested in this area and wants to learn. So that's brilliant. Excellent. All right. So, sorry, I'm going to start off with a lot of questions and then probably we'll move on to specifics. But the first question is, what is learning? When we hear this word learning, what comes to our mind? So that's the very first thing. So when you hear learning, what does it mean? What does it mean to you? Any thoughts on this? Pick up an unknown skill. All right, brilliant. Okay, to know something new so that you have learned, discovering knowledge, exploring, that's also an area. Okay, acquiring or getting a new knowledge and skill. So again, it's something like most of you are sharing, discovering, understanding, gaining, acquiring knowledge or skills or certain behaviors, etc. Right? And also, I think someone has put in there as an observable change in behavior based on new knowledge. Brilliant. We are already going into educational theory here now. So when I think the focus is that once you learn something, you are not the same as before, right? So your behaviors change, your thinking may change. Sometimes even the new learning, the new acquiring of new skills may change your value sets as well. So this is really good. You are just you are sharing your thoughts, mastery. Again, another excellent way of looking at things, discovering, gaining knowledge. So we are seeing more or less, the discovery part, gaining, achieving mastery, change of behavior, etc. And you are very true. These are all part of different learning theories, right? Acquisition of knowledge is a traditional theory. Permanent change in behavior brought about by experience, the behaviorist theory. acquisition of insight and rules governing certain relationship in the environment, the structure of disciplines or the cognitivism. Learning is when person receives, organizes, stores, and retrieves relevant information. Or learning is the discovery of new facts, skills, relating them to those already known, a constructivist approach. So you can see the red ones, I will probably focus a little bit more that these are the theories that may underpin. We are going to talk about some of these areas that underpin our adaptive learning and also gamification as well. So learning can be looked at in many different ways. And of course, there are specific learning theories and there are sub-theories in learning, etc. as we go by. But I think these are the key, the key theories that kind of, underpin. And there may be other sub-theories that go along with that. Right. Now, if that is learning from what you have shared, discover, understand, grow, develop, what factors or conditions facilitate this learning? Especially learning something quite in-depth or engaging in learning activities so that you learn really in-depth, right? Okay. Okay, so this is a word cloud. So the more you write on a particular word, it will come, we'll see it bigger and bigger, right? So I'm saying environment coming as in a big way, right? So facilitating learning, someone's creating that conducive, safe environment for learning. Motivation. Also, I'm seeing one's own interest, experience, collaboration. I'm seeing, right? So this is really great, right? So we are seeing quite a lot of areas, right? So I think the key ones are environment, motivation, then of course the interest, right? Also a need. Yes, I understand, need to learn, right? Fun, having fun, it also facilitates learning, right? So you can see that you are bringing in these conditions. Now, why are these conditions important? Because we are going to learn later that these are the ones that especially the gamification tries to capture, right? So let's look at some of these things later in a little bit more detail. Right. So as shared earlier, learning is facilitated by all these areas. For example, the active engagement, having the right context, because when there is the meaningful context, it actually is relevant. They remember better. They can apply what they are learning in that particular context, so it is more meaningful. And they remember and they can apply that later on in much better way. Critical thinking and reflection, the scaffolding, making learning into, the bite-sized things and then making it having a structure, providing the support, collaboration, right? And we do know, right? We are trying to have more and more collaboration or collaborative learning. Then also providing students with diverse teaching methods. Not only the same way, not just giving lectures or even all together small groups, but having that different learning approaches, different learning methodologies. Then, of course, encouragement of autonomy, especially in adult learning, right? We do like to be independent and we want to learn what we want to learn and where we want to, how we want to learn and from where we want to learn. A lot of you also shared about the emotional and motivational factors as well. So these are also quite critical, right? To learn, you have to have that right attitude, the emotion, And then, of course, both the intrinsic and the extrinsic motivational factors. Increasingly with our students and our younger residents and colleagues, the use of technology, right? So they're like fish to water. They like to engage in technology. Developing one's metacognition, learning about learning, right? How did I learn today? What more do I need to learn? What are my gaps? What are my strengths? And how can I mitigate those gaps? Where can I find that information? So learning about learning, right? Getting them to critically reflect and also developing their reflective abilities through our learning approaches are critical, right? So that also facilitates one's learning, especially the deep learning. Then, of course, we discussed earlier about scaffolding and other things. How do we actually give them that, the bite-sized learning point so that learning is paced and also it is at the right amount that you can learn and you can remember and you can store and memorize. And then, of course, having realistic challenges. It's not too difficult, not too easy as well. Not if it is too easy, those learning tasks, they get bored easily. If it is too difficult, after trying for some time, they give up, saying, "Oh, it's too difficult." Again, I want to emphasize that these are the elements that gamification tries to capture. Being actively engaged, having those things in certain meaningful context, getting more collaboration with the peers and others, right, through competition, etc. Having multiple different options to learn the same content, encouragement and autonomy using different approaches. And we are going to talk about this a little later on. Creating that attitude and the emotional and the motivational factors. The use of technology, developing one's own learning. Have I really attained a certain level? What more do I need to do to attain to the next level? And then, of course, working within the certain limitations so that you learn what you need to learn. And then, of course, having those realistic and challenging tasks. Games, planning it in that particular way. Right, so with that, we come to the real nitty-gritty about adaptive learning. What is adaptive learning, right? So adaptive learning is basically personalizing one's own learning experience. So this is basically tailoring the instruction to each of the students' strengths and weaknesses through identifying the patterns of their engagement, how they answer or how they actually work on a certain problem or a game, and identifying where they are, what they know, and then assessing that and then delivering targeted content and activities as well as feedback in real time. So adaptive learning approach contrasts with the traditional one-size-fits-all because it's a very dynamic process, right? And this is, I think, this is quite nice, a kind of a differentiator between the traditional learning modes and the adaptive learning. The key here is personalizing learning and the use of real-time engagement and feedback to customize and tailor those things, those learning content, the material to the learner's progression or the understanding. So why adaptive learning is important? Well, it's a no-brainer, right? Because it addresses a diverse group of students, right? As we know, we are in our classes, even though they come into the classroom with a certain abilities, even they get into our programs with a certain A-level or IB or IP or Z scores from their JCs or high schools. There's a wide spectrum of students, right? So adaptive learning, if done properly, can personalize learning and addresses these diverse needs. Improve students' engagement because it personalizes. And of course, this leads to better learning outcomes. Someone also mentioned about mastery, right? So if the process is planned and put in place from a novice to an advanced beginner, or you can master a certain skill set if you develop it properly. And then, of course, self-paced learning and providing feedback gives you that insights, not only for the student or the trainee, but also to the educator. Scalability, because again, this is based on the students' abilities. And then, of course, you have the learning that at different levels developed, where it will provide that scalability to a larger group of students. And then, of course, continue with the lifelong learning. So these are, again, from some of the literature, how this has worked in different settings. Now, with this, I just move on to asking you a question. Why do you like, doing a hobby or sports? It's fun, yes. Right? We like to do things because it's fun. Right? There's interaction, yes. We play with someone. There's competition. There's interaction. There's fun. We have discussion. Yes, of course, by doing that, we become healthy, right? There's socialization, competitiveness. You can see, yes, the engagement, trophies. So you're actually doing something. You are engaged in a sport because you want to win. You want to achieve something, right? But yes, I'm seeing a lot more fun here, right? Than the other thing. So to get rid of boredom, yes. Bring as part of to be with a group. So I can see quite a lot on the fun part, the reduced stress, I think, more interaction, awards and rewards, right? Achievement, right? Okay, friendly sabotaging, yes. And also competition, that's true, right? To socialize. So these are all the things why you want to engage in a sport, or why you do hobbies as well, right? So these are again elements that we try to capture in a gamified environment. So now let us look at there was a question. I mean, I'm putting some of your questions also into these slides so that it's more relevant and it is aligned to what you want to learn. So how does adaptive learning and gamification work, right? Now, we talked about adaptive learning and we talked about games, right? Now, imagine if we can put these two things together, right? It personalizes, it provides feedback, it gives opportunities. And here, if you can combine a game, imagine the potential for students, right? Now, use of technology to tailor educational content and experiences to personalize, together with gamification, where you put game-like element into non-game context, like learning, right? Learning something boring subject. Okay, I'm sorry if there are biochemists here, but biochemistry was something very boring for me when I was in the medical school, right? But again, imagine you putting in something that, like, the TCA cycle, it will immediately, if that's a game, you learn through games, right? Pharmacokinetics and dynamics, again, something I think I started losing my hair when I started, all this learning about all these things. But imagine if you can put a game and it adapts to your level of learning, and then as you progress, it gives you more and more content, allows someone to work with you as a game and a competition, and then it provides you, rewards you with feedback, and also provides you with other things like badges, which we are going to talk about later, right? It's so powerful, right? it can get students to focus on their learning. So this is where combining these two really makes sense. And there are many things like that. Some of you have asked what are some of the examples. So I know Piani, Socking, they have been doing a lot of work here. Alfred Cow from the School of Medicine has developed games in patient safety. Some boring areas where students don't want, even though it is really important, right, for them to learn and to understand. So these are some very interesting ones. And actually, if you go to the CDTL, or it's called now CLTL website, under the lift grants, you can see quite a number of such games, gamified learning content being developed and put in place. I'm going to use an example because this is something that I managed to get from one of my colleagues. But I'm even though I show this particular thing, it is what do you call it, commercially available. I have no shares in it, or I have no interest in this, or conflict of interest, or I get in money or anything. I'm just using it as an example, right? So I will show you later on about shadow health, and it's a typical example of a gamified thing. So even our healthcare institutions, this is from Sync Health, right? So Sync Health, again, training their healthcare professionals in areas like patient safety, areas where infection control, etc. Hand washing before actually they get into the actual practical things, for them to learn the basics, the content, etc. They use gamification and adaptive learning. Okay, so how does it work? So first of all, we discussed, right, why we play games and how do we create the learning environment earlier. You shared with me what your thoughts are. And these are the adaptive gamification models or platforms actually uses both these, right? First of all, it provides real-time feedback, and there's instant rewards through badges, leaderboards, etc., which we will discuss very soon, right? So there's immediate feedback, and there's also progress indicators. So it actually motivates. It's fun. It gives feedback. It motivates, brings out your, that real sportiness in you. So it brings that into forefront. Next, engagement through challenges and quests. So we all like a challenge, right? So it adapts. It creates challenges and also certain quests, certain areas that you want to kind of, go on, treasure hunt or something like that, to the learner's level. And it nicely integrates this adaptive learning content into engaging stories and games, right? So treasure hunts, finding things, etc. As the student progresses or the trainee progresses, the story also evolves. So it creates interest. You want to find out what's going to happen next. At what level, the next level, what is going to happen? How can I, get to that level? So you continuously involved in the game while you're doing the game through other measures, right? Through quizzes and other things, you also learn. And then you also, the educators see whether you have learned or not, right? So these are the main things. Then also we discussed, right? We are social animals, right? So social learning and friendly competition. So again, leaderboards, we'll talk about leaderboards later on. In working with another person, another group of students, or as a team, right? The motivation is there. The space is safe, right? No one is looking at you. No one is with judgment on you. So you are safe, right? You are happy to make mistakes, and by doing mistakes, you learn from the mistakes, right? As a team, people get together, and you can see that some of these gamification, that individually you work, and then suddenly you need to make a team, and then as a team you actually progress through the game as well. So here again, something that motivates, socialize, and get people involved. As the student goes on, we talked about mastery. One of you shared about mastery about earlier as well. So again, developing one's own skill set. So as we go along, as we improve from one level to the next level to the next level, you feel really, really good about yourself, right? And you master the skills. You try to get as much knowledge as possible, right? So this is encouraged through giving of badges, trophies, extra points, etc. Right? So these are some of the key elements in gamification. Right. Let's look at this short video. Oops, I think I need to add this with sound. So I think I have not added this sound. So just give me a second. Okay, here we go. What happens?
Elsevier and Shadow Health. Best in-class simulation experience, leader in healthcare education. Virtual patients have diverse personal and medical histories and can answer hundreds of thousands of questions, so the responses are as varied as the patients themselves. Conversations in real life aren't scripted or multiple choice, so Shadow Health's digital clinical experience creates real-life situations for students to apply clinical judgment when addressing each patient's individual needs. It's from these virtual patient interactions that instructors can truly quantify students' critical reasoning skills. And the instructors' detailed assessments are what differentiate Shadow Health's simulation experience from any other. Let's step into the exam room. It's an hour after the student's initial patient assessment. Now we can watch the student's interactions with the patient, Gabriel, and his mother, Yvonne.
I feel better now. I can definitely breathe better, but my chest is kind of sore.
An important part of the learning process is for students to be able to balance asking questions, delivering therapeutic communication, and educating the patient. Simulation experience encourages students to practice clinical reasoning skills through realistic interactions. Now let's check on soon-to-be mom, Luna.
I'm excited. After today, there's gonna be a new member of our family.
More than asking patients questions, the simulation experience includes opportunities for nursing interventions and for demonstrating empathy toward patients. Thanks to Shadow Health's simulation experience, when students complete their healthcare studies, they're patient-ready, capable, and confident. Join us, Shadow Health, from Elsevier and Shadow.
Okay, so I want to share that I don't have shares, so I don't get royalties from this company, but it's just an example that I just wanted to show with you. As I mentioned, there are similar examples at Alice Lee, Yonglulin, where they have also used gamification. And there were some questions about how this has been used in Alice Lee and also in nursing. So when the discussion phase comes, I'll get Piani and other colleagues from Alice Lee to share some of their excellent work that they have done in this space. Right. And there were many questions we discussed earlier. There were many questions on how gamification increase engagement, motivation, and participation. I shared some with you earlier, but one of the things that really motivates our students when they are playing with games, it's the points, right? So as you achieve certain level, you complete tasks, you get points, right? So they try to get as much points as possible, because as you gain more and more points, you get certain badges, right? So these are elements in gamification that you get these badges. So when you receive multiple badges, because you are scoring a lot and you are gaining a lot, by learning the content that you're supposed to learn. And that's how you collect points, because you answer quizzes, you solve things, etc. You get badges, and with more and more badges, you go to these leaderboards. So leaderboards, if you're playing this game with several of your colleagues or several of your peers, then you can see where you are with regard to their peers, right? So rankings actually displaying through these performance levels, actually this foster a sense of competition and also achievement by the student. Now, with leaderboards, when you are moving and gaining more and more points, badges, and you are at a certain level in the leaderboards, you go to the next level, right? Now, we discussed earlier that this also motivates students who are playing games, right? In the gamification, the levels actually help them to see, okay, I'm moving up one more level, the next level, the third level. So they're trying to advance. As they advance, they also move towards more and more becoming more and more competent or knowledgeable, and then achieving that mastery. Again, another area that we discussed that increase their engagement, motivation, its challenges and quests. So while the game is developed, the storyline, this can lead to specific tasks or specific missions where they acquire more knowledge, right? Or more in-depth understanding in a particular area. These are encouraged to complete so that there's to provide a structure, goals, or drive into engagement through purposeful activities. This again enhances motivation, as I shared earlier, and it keeps them engaged with the game, right? So it's not boring, right? They're not doing the same thing all over again. There are the challenges and quests, which leads to rewards, right? Extra rewards. And we all like rewards, incentives. And individually, you can have your own progress bars. Right? So you can stop the game and come back, but you know where you are through your progress bars. Then, of course, incorporating narratives, especially in patient stories, as you saw in the earlier example, bringing story elements into a gamified experience, increase engagement as well. It has been shown to increase engagement. This is true by creating an immersive experience, because the student is now really engaged and learning the content that they're supposed to learn. It also provides a meaningful context, right? So in healthcare, we do know the context plays a large part of one's learning and impact later on as a practitioner. So here, having these storylines, having these narratives embedded into the game makes them really engaged and motivated. Then, of course, different avatars, right? They can play themselves or with the others coming in. So they can customize these avatars. They can personalize, increase their own image, right? So again, it's that safe space, right? You can bring those elements into the gamified thing, and this has also shown to increase the engagement as well as interest in the game. Social interactions we talked about earlier, and then these other ones, what we call the unlockables or Easter eggs. Sorry. This also actually helps them to motivate. So these are mysteries, right? So you go on, you do certain things, you actually reach a certain milestones, certain level of mastery, and these things unlock, right? So that will give you more points, a higher level, a surprise, or kind of a delight. So the people who are involved in gamification, they would like to see these things happening. right? So these unlockables, suddenly it opens up, Easter egg opens up, right? It's something that, that will surprise them in a nice way. Not suddenly they will be gobbled up and they go one level down, but this will help them to achieve a higher level or give them more tools to navigate in the story or the game, the next round. All right. So as an educator, and as I mentioned earlier, as a person who kind of evaluates and helps them to evaluate, how do we integrate gamification into adaptive learning systems? First of all, I think we all know we need to define the learning objectives and goals. We need to know what we want at the very beginning from this particular experience. Because it's not only fun. We want them to learn. We want them to learn meaningfully. And we want them to have that knowledge or the skills that they're developing to be applicable in the future. So we need to be very clear with what we want with our this particular learning approach, gamification. Just like if you are developing any module, any course, or any curriculum design, the first thing is that you need to be very clear with your learning outcomes. Next, it's important to understand your audience. Now, sometimes this may not be suitable for your cohort. That is also important for us to understand, right? Because once we understand our audience, then we know what kind of adaptive learning combined with games or gamification we could use. What type of games, what type of things that would interest them? How would they engage? So all this depends on your audience, right? So understanding the audience is really critical and important. Then we come to designing the gamification framework, right? How do we select the appropriate game elements? How do we create the storyline, right? Or theme? Those are the part of the gamification framework. Very often I see that the ones who are like me, a very novice into this area, it really helps to get advice from a person who has done this earlier, or even from a gamer, from a student who is in your program, but would like to help you, right? So partner with someone like that. And then you can understand what type of storyline that you want to put in place. Then integrating the adaptive learning features. So personalizing learning paths for different learners in your group, putting in the real-time feedback, right? Incorporating that real-time feedback. Those are important in the adaptive learning, because we discussed earlier, adaptive learning is personalizing learning, identifying their strengths and weaknesses, providing with the right content, and then providing them with feedback, right? So those are the elements that when you're incorporating the adaptive features, you need to think through. Then, of course, developing the system architecture. And this is where it gets complicated because you need the technical jargon, right? So that's where probably most of us, we need someone who understands and who has the capability or the understanding and the know-how to work with us, right? So our IT colleagues from CDTL or CLT now, getting them involved. It's really important to make sure that the technical integration part happens, because this is where it is important. And also the scalability. Sometimes our platforms may not be able to handle large number of students playing the game at the same time, right? So therefore, again, need to understand that, and then what platform is really is important. Implementing the data analytics. So tracking the learner's progress, and then how to adjust the the content dynamically. Those are all important. Again, you will realize while you have the content expertise and you know what they want, what you want them to achieve, you have to have that technical colleague also helping you to incorporate some of these elements. So once you put these things in, I think the next is to see how to adjust content live, right? So dynamically, how to adjust this and how to utilize the data that is being generated on the student, or what we call in technical terms, the gamer, understanding the level and then providing the content in the right way. So for here, you need to have pilot testing and then using that data to see whether your process works or not. So once you pilot test and you're really happy, yes, there's adaptive elements, there's data analytics happening properly on the background, on the back end, and the content can be dynamically adjusted and given to the learner at the appropriate level through the pilot and by multiple testing. Then we move to the next stage to launch, and then of course need to monitor from back end. One of the areas that where from literature it shows that where you have done everything perfect earlier, right? We have done everything perfect earlier. Where it goes completely wrong is not providing the necessary support and training. Not only to the students are fish to water, they can get into this, but to the faculty members, right? Your colleagues. So they also need, because they are part and parcel of a course, right? So they also need to be trained in how to use and how to utilize this in a very effective way. So that part in many places have shown that training instructors and educators how to use the system effectively and how to leverage on gamification elements to motivate learners is a part that sometimes we forget. Right? So this is really important. So we need to offer guidance and support to learners to help them navigate, but also to the faculty members as well. So providing that is really important. And then of course, monitor and CQI, continuous quality improvement is necessary. So these are some of the key elements in integrating gamification into adaptive learning systems. Right? You will see that it's not just one cannot do it alone. You need a team, and you need a good team to help and support. So the important things to remember, we are not playing just for fun, right? It is also learning. So balancing fun and learning is important. It is important to encourage what we call collaboration, because a key to learning, a sense of learning is collaboration. Through collaboration, we learn a lot, especially in health professions education, because in the future also we need to collaborate. So including those features like team challenges, peer interactions to develop that collaborative environment. Recognizing the achievements, celebrating learner achievements through rewards, the badges, the leaderboards, the levels, etc., is really important to sustain their motivation. Oversight, right? Using analytics to identify patterns of learner engagement, and also to adjust some of these strategies is really important. Another thing is that once you start doing this, if you have a series of such things put in place, it has also been shown that you can develop certain predictive behaviors of learners as well. So you get more insights into your learners, and then you can develop more engaging stuff later on. And then of course, accessibility, right? Can the learners access? Do you have the enough bandwidth, the Wi-Fi, the system capabilities, etc.? So these are important things to remember when you are putting in games for learning. Okay, oh, something has happened. Okay. So after going through all this, right, I just want to get your thoughts. Now, if you are thinking of using games in your courses, or if you are already using games in your courses, what are some of the challenges and what are some of the limitations? Some are perceived because you may not be using them, but others who are using, there are quite a number of you who are using games. What are the issues and challenges? Okay, brilliant. I think this is very true, right? Stigmatization. Others can, so this is, you can vote for this, right? Okay, jaded learners. Okay, that's interesting. Regular follow-up, technical difficulties. Yeah. Funding, absolutely. Yeah. It's not something that you can do. You need a lot of funding and support. Limited scenarios. Okay. Imagination is your thing, right? So don't leave it by just focusing on one, but having a bigger imagination. Okay. So oversimplification, yeah. So that is why that we have certain levels as we go along. We can really improve. Measuring the return on investment or effectiveness. Again, a part of program evaluation, how do we actually effectively measure? And we'll discuss that a little bit because there were some questions earlier. And I'll share some of the literature with regard to gamification. Not very much in medical education on the impact and effectiveness leading to healthcare, but of course learning. There's quite a bit on learning. So stigmatization coming in, addiction. All right. So again, the balancing part, right? Mimicking real life scenarios. Oversimplification we talked about because we shared that you can have different levels. Lack of time due to congested curriculum. Yes. And very interestingly, in some places, they use gamification to reduce content, right? Reduce the number of lectures because the students love playing games and going into more in-depth areas rather than going to 10 lectures on cell signaling, right? So using the concepts and the constructs, biomedical science concepts and constructs, you can develop a game that they will learn more. Again, one of my colleagues, Judy Sung, they're using a similar approach in teaching students pharmacology, deeper concepts in pharmacology. So again, rather than going to 10 lectures, or I'm just exaggerating, 3 or 4 boring lectures on pharmacokinetics and learning about that, they can actually do a game and learn the same thing in much less time. Then you reduce the content, allow space. Okay, lack of authenticity. Yes, so the storylines are really important. That's something that we need to focus on, making it real life and context specific. Time consuming. Yeah, initially it is, right? So this is why we need the institutional support, the faculty support to develop. But once it is developed, once it is launched, then it's the other way around, right? You actually save time. You get them to learn. You manage to see how well they are learning through learning analytics. And then also you can give them more difficult challenges, etc. You don't need to be there, right? So it can save time, but initially it is difficult. Can become over competitive. All right. So again, balancing learning and fun is something that is important. Addiction, again, the balance. We talked about mimicking life. Congested curriculum. Student may focus on cheating to win rather than learning to win games. Yeah, possible. Some will focus on becoming non-authentic. Again, I think it's the clarity, right? We need to bring in. If we are very clear with our students, These are done because we want you to learn. If you don't learn, well, the immediate consequence is that assessments, right? You won't get through those assessments, because I'm not going to give a lecture on this again. This is where you are going to learn, right? We are not going to do again a large class or, etc. So this is something that you have to learn on your own or with your colleagues. But the more important thing for health professions is that unless you know this, it'll be very difficult for you to go into the clinical years and learn or even to practice. So you jolly well learn this rather than cheating. Right? So these are some things that are important. I do not know how to create game. Yeah, none of us. I mean, most of us, right? I also don't know anything about how to create such things and games and avatars and all these leaderboards, etc. So that's why it's a collaborative thing, even developing. So working with our colleagues on the other side, and I'm sure Piani and Tanshri will be able to share a bit about their community. I think this is a great initiative by Piani and Tanshri and other colleagues at Alice Lee, creating this small community so that we can share, we can find where the information is, who are the experts in this, who are the technical experts, and where the funding can come in, and how to be successful in getting grants, etc. And a community is needed. And I'm really grateful that they have created this community within Young Lulin, so that not only the nursing community, but also a wider NUS community can also benefit from this. Yeah, so I think these are all areas. So let me share with you very quickly from the literature itself, some of the challenges, right? Some common challenges. So we discussed this, right? Balancing education content with game elements, right? So this is an important area where you need to focus on prioritize learning objectives. Remember what we said, discussed earlier, that everything starts with what you want to do and where you want your students to be, right? So learning objectives and outcomes, and then see how the gaming elements can support, not replace, the educational goals, right? So it's not just fun playing games, but they're learning something and they're mastering skills or achieving a level of competence. Then we talked about this, right? The technical part. So integrating adaptive learning systems can be complex and also costly, right? So using like already scalable platforms, and there was a question earlier, and that's why I particularly focused on this, using the APIs integration for seamless integration of the technical part with the game, with the adaptive part with the games, right? Gamification. So you can use simple platforms, even like Moodle. There's iSpring Learn, so 360 Learn, even Canvas, right? So again, using such platforms, and then of course you need to get that technical expertise, right? Another thing that has been discussed is that actually, just like anything, the students' motivation declines over time. So how do we keep students engaged and motivated? So one way is that not to release the entire scenario or the storyline in one go, right? So you can improve it. You can actually use the basic storyline, and then later on the more complex storyline coming in. The other way is again updating the game elements. So once, I think, a lot of discussions on and also sharing. There's a special conference exactly on this. There are conference proceedings if you want to download and to read. So I also, because of this talk that Piani asked me to do, I started reading a lot about gamification and adaptive learning systems. So this conference entirely dedicated for this area. What they share is that once you get the hang of it, even as a novice, and then once you get the hang of it, developing these content, then you kind of master how to update game elements, right? Of course, together with some technical backing, but over time, you become quite good at it, right? So I think it's the first point is that just to get over this, right? The first barrier to learn and then how to apply it. So the other things about, those dynamic challenges that we talked about, mystery prizes that the students could collect and get themselves rewarded. Those are important elements to keep the motivation of our students going. This is another interesting and important area, ensuring fairness and inclusivity. So again, as we know that we have very diverse group of students, right? So whether these are fair, inclusive to all, can all of them get engaged in this regardless of their backgrounds or abilities with regard to their resources, etc. So these are important things that we need to focus on. Again, important is to test the system by running pilots before you actually launch, and have those conversations with students who may not be able to engage in such things, and see what you can do about it. Another big area is the data privacy and security, because your learners' engagement, their level of learning, their abilities are all captured here, right? So the moment they engage themselves in a game, that the adaptive learning system captures all this data. While it is really important and useful for us as educators to understand individually and as a cohort wise what their abilities are, what they are good at, and also we may be able to, if we collect over time, project their capabilities, and also identify at-risk ones, and then the ones who need to focus on. It is also a threat, because someone can hack into the system and get this data, right? And this is something that we really need to focus on, and that's where we need to comply with the institutional rules, the compliance guidelines, the regulations, etc. And also, I think, I mean, we have very simple platform called SendMed Scholar, and there are few very interesting things where there's adaptive elements in that we have put in place. It's a faculty development platform, and regularly our IT colleagues ask us, can we get our the vendors to hack it and see whether they can hack into the system. So again, those are things that we can do to protect. Come back to this. I'm a people's developer or a faculty developer. So providing adequate training for educators is a big hindrance, and that's where the negativity comes in. That the topmost things that you all mentioned is that the mindset, right? So the negativity comes in when our peers, our colleagues don't know what this is all about, and how they can how they can involve, and what's the impact of this, and how much how powerful this is to learn and to understand your learners, right? So when they don't know and when they are not very well trained, then of course, as human beings, we don't like something that we don't understand. We are not very good at, right? So this is where, again, those training programs must also be planned from the very beginning. And of course, monitoring. There's an oversight. We need to have that oversight and constantly look where the gaps are and how to improve and mitigate those areas. All right. What about the future? Right? I always like this quote from Buckminster Fuller, who is a systems engineer, says that you can never change something by fighting the existing reality. To change something, you need to build a new model that makes the existing system or the model obsolete. It's a really good quote, right? So what is the future? So you listen to my boring, blabbering for the past 1 hour or so. So what are your thoughts? Where could gaming could go in the future? No idea. Okay. How gamification could enhance? Okay, lifelong learning, absolutely. There's quite a bit of discussion happening. I'm also involved in a CPD group, an international CPD group for health professional educators. They are really focusing on two things that you have mentioned here. CPD training as part of their professional lifelong development and learning, and also on-demand learning. As you know, busy clinicians, they really have limited time, right? So on-demand learning, that's where this can really be useful. Adaptive learning with gamification. A simulated safe environment, yeah. It's a trend. Yeah, so there are certain trends happening, but some trends are good trends. Absolutely. So what we want, right? The outcomes that we are looking for. Okay, so let me again share some of where some of these winds are blowing from the literature again. Okay. Another tool to engage both learners, young and old. Yes, we all like games, right? So we would like to get involved. Promote above, badges, rewards, research, procedures, cases. Who knows in the future, some of these may be part of parcel of our promotion and tenure, playing games, right? We don't know, right? So have our imagination. Yeah, familiar environments with learners as they used to games nowadays, yes. Works for older folks. Okay, you'll be surprised once you get them started. It's really interesting. Actually, there was something, I didn't read that particular work, but use of games in old age homes, right? So getting this, the ones in those homes involved and then playing games, but it's not in higher learning or higher education. So yeah, I think the old dogs can learn few new tricks, right? More familiar environment for current learners as they are used to games. Okay, technology such as AI, virtual reality may exactly. This is something that I'm going to talk about in a couple of minutes. Personal connection with the training and the learners. Okay, patient safety. Yes, of course. As you know, Pass It. Alfred's Pass It, the patient safety game, is an excellent one. Socking's interprofessional collaboration, that game with avatars. So I think that's another area that this is used. Working with older folks with games is very hard for them to grasp. Yes, I think it is. It all depends on how complex. So understanding your audience is really important. If you develop a very complex one out of context to that audience, then of course it is too hard, too challenging. They will not use. But making it easier for them and making it relevant and meaningful, yes, I think it becomes much easier for them to engage. All right, so time is catching on. So let me share some of the future possibilities. Again, this is not my only thinking. This is also from literature and also by having some conversations with some colleagues. So I think one of you mentioned earlier, right? Combining the artificial intelligence, virtual reality, and augmented reality into gaming. And this is something that is going way into the future, right? Elon Musk even putting a chip into your brain, right? So creating that experiences. This is something that is really focused on by many of the gaming companies. And I'm sure that this will come to health professions education also, like, with surgical procedures, patient interactions, emergency responses, scenarios, mass casualty games, etc. Right? Because we do have a mass casualty triaging scenarios also here. So we talked about AI-powered personalization and personal tutoring. Everyone likes personalization. Our students love to learn individually, and they would like to learn, tailor-made to its own their own needs rather than a large group. Something that is coming again is in gamified competency-based education. So focusing on specific competence and then providing certain games to develop that competence before they go into the actual practice, right? So allowing certain level of competence, using micro-credentialing, use of badges and other things. This is another area that is happening. Promoting more collaborative and social learning. We talked about IPE, interdisciplinary, teamwork, etc. Use of gaming analytics. A lot is being done in this space. Elsewhere, the short video, they actually, if you go to their website, you will see how powerful that they are using the analytics to identify the learners, especially to identify learners who may get into difficulties in the future, right? So these are areas, and also developing the soft skills and professionalism. I think the Alice Lee has done quite a bit of work here as well in communication and developing professionalism. So in summary, yeah, it really gives you that personalized experiences, real-time feedback, data-driven insights, immersive, engaged learning environments, and can promote collaborative learning. But the more important thing is that we need to know what we want from adaptive and the gamified learning environments, right? Gamified adaptive learning environments. So if we know what we want, then we can develop, and then we can put those things to enhance our students' learning. So with that, I want to thank Piani, Tanshri, Shan, and also the NUSAI community. I also want to thank my SENMED colleagues because they also helped me a lot. And also today we are actually in the midst of hosting a visiting team who is here from a medical council, who is here to understand our quality assurance processes at the School of Medicine. So they are actually doing a lot of work on my behalf while I'm here. So I want to thank them. And I want to thank all of you for sending in your questions that really helped me to align this session with what you want to find out also. So with that, thank you very much. Over to you, Piani.
Thank you very much, Dr. Dujibar. I think that is really an excellent presentation on the adaptive learning gamification. It's quite detailed, and you're right. You cover all the questions that participant has sent you earlier. Thank you for that. Before we go for the question, maybe I'd like to introduce our team member here. You mentioned Dr. Tanushree. She's there. Okay, can I say hi to her? Hello.
Hello. Hi.
And also Janet is also there. Janet is also the facilitator for the NUSAI Health Community, so she's there. And Shawan, where are you? Are you? Oh yes, Aparna is saying hi from UK. Hello, nice to see you. And Shawan, are you here? Okay, Shawan did a lot of detail work on organizing this webinar. So thank you so much. So Janet, Tanushree, you have any comment, anything, any question, anything to share before we go to specific question from the participant?
Yes, thank you very much, Dujipa, for that very enlightening talk. Now, when we talk about gamification, right, essentially when we're talking about gaming, it's not just technology. Initially, gaming, anything gaming has game aspects. So for me, my experience with gaming is that I've started with, the basic paper and pencil, crossword puzzles, and then moving on to Kahoot and web-based learning and all these things. Now, we're in the age where we have a generative AI. I'm just wondering, how can generative AI further enhance personalized gaming strategies? I mean, you've mentioned a few, but I mean, what do you think is, something that needs to be really focused on in terms of utilizing generative AI?
Excellent question. So this one platform I mentioned, they're actually trying to combine the generative AI and also AR and VR experience. iSpringLearn, I think. What they are trying out right now is to see whether using the AI capabilities, whether the scenario can the AI generate similar scenarios, similar more engaging scenarios, and also change it in a way that it is not really algorithm based, right? So creating that and creating it in a VR, virtual reality, or augmented reality environment, right? I think that would be very powerful in learning, right? So a student, so it's not the developed storylines. The AI actually understands what the story is, the storyline is, and all that, and then it will try to create or adapt or change the scenario to different learners. Now, that would be awesome and extremely powerful, right? I have a little bit, sorry, go ahead.
Yeah, no, I was like thinking, yes, definitely it will be awesome. But how do you think, how long do you think will it take for us to be able to utilize, such a strategy or such an approach?
Okay, I always say this: think big, start small, act now, right? So, Jeanette, you mentioned earlier, right, what you started off with, right? You start small, you use paper and pencil, quizzes, etc. But you have started something. So I think those things are out there, right? So they are being developed and they are being as we speak. People are involved. A lot of money invested, right, in these areas, especially in health professions, because that's where the money is, right? These professional programs like medical, nursing, dental, pharmacy, and then other professional programs like engineering, like so that's where actually why the companies are investing. So when would it be available? I really don't know. I can't predict, but it's happening and it's going to happen in the future, right? So I think the important thing is that for us to be engaged, to be very open-minded, and then having these communities. And this is why I always really love and I want to support this community.
Thank
Is
you.
because having this community actually builds that interest. You share, oh, look, this particular thing. And I just saw on the chat someone has shared.
Yeah, I saw that. I think
Right? Yeah.
yeah,
So
he showed the platform. Yeah, go ahead.
correct. So there are things available, right? So when you have a community, you can bring that collective wisdom together, the knowledge, the resources. And it will be quite, I think, before we die or before we retire, these things will be there available for our students and even for us as practicing clinicians, right? As our CPD, etc.
Right. So I think someone share Hasnan, right, sharing some platform for the game. So you can see in the chat WW Spatial and Second Life, right? So if you if anyone interested, yeah, you try that, Dr. Tujiba, the
Second Life has Second Life has been
cool.
mentioned by many of the in some of the proceedings. They have mentioned about Second Life, so I think that's a popular platform. Generative AI.
Thanks, Dr. Dujipa, for such a wonderful insight. And really, we need to start small. Each one of us need to start small. And but I just wanted to bring it to another aspect of it is, even though we start small, it's very important to get the analytics right. To see the analytics. AI can play a big role, right, in the especially the dynamics of the content adjustment. So currently, like in our learning management system, which we use Canvas, when we look into the analytics, I mean, I had a very small game as I started very small. I can see that the engagement in that particular week when I uploaded the game, it was like it's just went up. The students were very excited to practice the game, but I could not see what was the, like where the students were like stuck and which student was not able to progress, because I could see that many students left the game halfway. So why? Maybe that they found it difficult, they found it boring, they found it too easy. So those are certain analytics which, if we capture, maybe we will be able to, improve our games and improve the learning. So Dr. Dujipa, your take on that?
Yeah, so one of the things is that I mentioned, as part of the overall game planning and the design process, we need to collect also the learners' feedback, right? So one of the things is that, again, we need to find out why did they learn, why did they leave early? What was the issue? And this is part of the continuous quality improvement process, right? So as you mentioned, did they leave because they found it difficult, or whether it was kind of boring, right? There's nothing, it's not engaging. Or is it because that they felt that they're not learning? Or is it too simple so that they can learn this content in 5 minutes opening a book? Or the other area is that why that students are not involved is because we try to gamify content that is available, or they have access to. So example, they have a lecture and then we try to gamify some of the content in the lecture. It's different if you have a lecture and then certain concepts and constructs are difficult to understand, then you do a gamification, like what my colleagues from pharmacology has done, right? So they they learn about all about the pharmacokinetics, etc. But the actual the process they have gamified. So like you can teach about the the renal system, but the countercurrent mechanism, or how the urine is formed, how the different elements are absorbed and secreted, etc. You can do it, gamify that, so you get a lot more deeper understanding. So those are some of the things that why students may suddenly halfway go through. So you need to build in to the system that continuous quality improvement thing as well, right? It's very detrimental if you read through some of the work to mandate a boring game gamified system to students, right? That will kill them. So I think to engagement, yeah, Arthur has done quite a bit of this. I know this from anatomy, our anatomy. I think Arthur's PhD is on this area. So yeah, it is helpful to look at the game design to keep the students safe. Yeah, exactly. So we need to do a little bit of content analysis. Actually, Tanushree, your question also leads to one other question, which I may not have covered fully. There was a question on how can the effectiveness of gamification be evaluated on an individual student basis, right? So I think, again, this is where we use the learning analytics. For example, individual performance metrics, right? No, that is collected. So we track and analyze the students' performance data before and after the game. So you build that into the game elements. We also look at what you mentioned about their engagement and motivation to go into quests, to unlock the lockables, etc. Whether they are going into collecting points to go into a higher level game level, etc. The third is looking at the skills development as they move along, right? Are they developing specific skills or competencies, right? Again, looking through certain pre and post tests or quizzes or certain tasks, right? To see whether they are reaching a certain skills level. And then I think another important thing that would probably link up with what you mentioned is doing the behavioral analytics, right? So using this analytics to track individual students' interaction with the game, with the others in the game, and then also getting insights into their individual behavior. So there are two papers, if someone is interested, in the British Journal of Education Technology. They also highlighted how the analytics could help identify students, especially the ones who are really struggling, right? So by doing this, by having this individual learner analytics into their performance, into their achievement of skills, their specific behavioral analytics, right? How they interact with the game, how they interact with their peers, how much of time and effort that they are putting in. You can actually identify the struggling students and focus on individual attention for those students as well. So yeah, so those are important elements.
Thanks,
Okay.
Dr. Dujipa.
Yeah.
Thank you.
Right.
Maybe, yeah, if anyone wants to add on also,
Right.
we can see something in the chat, Piani.
Right. I'm seeing now. Yeah. I
Mm.
think author sharing the website on gamedeveloper.com, and I just went to check there briefly. Look quite good. There are also some other platform, Dr. Dujiba, I just checked last night as well. They're using the AI to integrate with the adaptive learning, and they can also add some game into there. But that's are expensive, so expensive. So it's then back to the funding. So it's quite challenging. So probably my question to you at this point would be, are there any possibility that the university can provide some platform that can allow other faculty member to use the game, to use as a free platform, and then can apply to different modules? Is it a possibility to do that?
Yeah, so this is where, Piani, I think the communities like this are important, right? Yeah,
Oh,
because
okay.
you see, if you individually, if you go to your department, or the school, or to the university, even CLTL, it's not that effective. But as a community, I think this is why I say that I really like this
I got you.
community, and also that I want to encourage this community. Because as a community, you get together and you try this out and show some of the work and the effectiveness or impact, and then go to the leadership and say, look, this is useful. This is what our learners are capable of, and they love to get engaged. This is how we can motivate them. And this will actually help them to enhance their learning. But in health professions, we have even a better thing, because this will actually improve their patient care and delivery, because now they have better understanding, they are more engaged, they are learning the content that they hate to learn, but it's important, like patient safety, infection control, those areas, practice-based learning improvement, those areas that they researching clinical research areas that they don't want to learn. Through this we can improve. Then of course, and then say that as a community, you have develop a certain expertise within the institution, right? And then you
I
can
got you.
engage with others, and then you can go and say, then we can, as not you, all of us, right? We can
That
all
I
go
agree.
and work with our leadership, say, yes, this costs $5 million, but it is really useful, because a lot of people will be using it in this way. Then they wouldn't say no. But individually, if you go and say that I want 5 million, yeah, they would say, oh, forget about it. Don't bother me. Right? But as a collective, we can.
Oh,
So
that's a very good suggestion, actually. So we come as a group and asking for the platform that we can use, and share among faculty member. Yeah, just listening. I think I cut you off on something. Okay. Okay. Sorry. Sorry. So Sim, I look at the chat over there, and I that's one question, Dr. Dujiba. I think it's quite a good question. Let's see, where is it? Talk about whether or not we can use the game to kind of do the assessment. Any possibility of doing that?
yeah. So this is where we come, where I want to focus on program of assessments, right? Right now, when we talk about assessments, the first thing that comes to our mind is high stake exams, assessments. However, if we think of assessments not as completely formative summative, but there are certain assessments that are low stake, right? And we want you to get involved. We want you to achieve a certain level of competency at certain levels or win certain badges. And all this will go into a final decision-making point. Then it's much easier to design games and put it in place. If you make it a very high stake, pass, fail, do or die kind of things, it's extremely difficult at the moment because to ensure reliability, ensure the predictive validity, ensure confidentiality, the security, all those things will go into that, right? You have to hit a very good reliability rate, to ensure that it's a good exam. But however, if you make it a low stake thing, that you need to get engaged, you need to win the gold badge, right? For you to move to the next kind of, training, or, you have to have 10 gold badges for you to sit for the final exam, or, something to that effect. Then people are more conducive to, getting those things and then doing that and learning from that. So I think that's where the gamification and adaptive learning is really powerful. If we build in the assessment component, if we build in a low stake assessment component to drive their learning, that would really work well. But I don't think it would work in a high stake environment.
Yeah, like ASCII. We shouldn't do that under ASCII.
Yeah, and I just like to add, right? I do agree with Dr. Dujipa that we shouldn't be using it for high stakes assessments. However, for low stakes assessment, we should actually align it as well with our teaching pedagogy, our approaches. Because if we're just doing gamification during low stakes assessment, and then we didn't have, or we didn't expose students to, gamification prior to that in their learning modes, then it will be difficult to actually use gamification for assessment. So this should be aligned, the way of teaching, the teaching modalities, as well as the assessment. Yeah.
Agree.
Correct. Very interesting.
Yani, there are other questions in the chat.
Right. Could you help me
I
with
think
that?
one very interesting question is from Arthur Lau. It has to do with convincing stakeholders during grant interview. Because apparently he had an experience where they wanted pilot data. But of course, digital games require funding in the first place. So it's like a chicken and egg. So how do we go about this? Any suggestions, Dujipa?
Arthur, if I know the answer, I would be getting a lot more grants.
I think, yes,
Yeah,
go ahead, please.
Piani. You go ahead, then I'll share my thoughts.
Share a bit on that. I think in NUS nursing, in our department, we initiate the grant. Not we, but I think the head and the administrator, they start to give us a small grant. So that's one of the solution in our department. So people can use that small grant to get a pilot, to do some pilot project, get a prelim data, then apply for a bigger grant. So that's a current development in our department. So that's quite helpful, I think. But how about your suggestion, Dr. Dujipa?
Yeah. No, I mean, I agree with you. So, there needs to be some what we call seed funding from somewhere, so that you can start off something and show the initial success and then get a bigger grant. And then you use that to get even a larger grant, MOE, TRF grant, and etc. Right? So it's like that. But also, again, I want to come back, shift back to what we discussed earlier. Individually, it is difficult. So
correct.
Very often, I mean, Arthur, just sharing with you, very often we tend to develop even games and things like that individually. But if we do it as a collective, right, and we go as a collective, right, it's much stronger. And also, if we can show that our games are not only for medical students, but also a wide range of students, and we can do that through games. And we do know that games can adapt to diverse group of professional groups, right? So it actually helps the understand anatomy for nurses because it is adaptive. It can adapt to the different programs, to pharmacists, for dental students, then it's much stronger. But I think two things. One is that if can we get a initial grant at least a seed fund to go to the next level. And then secondly, there are many such small seed funding, right? So MITI committee gives out certain seed funding. And so then you go to the next high one. But also, if we can work not only just individually, sometimes things happen only when we do things. Trying to collaborate, it takes time. But if we collaborate with a wider community, leveraging on platforms like the AI in healthcare community, and then show that whatever you are developing actually benefits a larger community of students, I think those things will really help to attract a good grant.
I see. Right.
There are
Thank you
few
for
grants given
to
by
grant.
overseas associations as well. So I think that's something that we can all look towards. Yeah. So that would be a discussion probably the AI community, healthcare community can have. Where are the grants? What are the success factors? What are the things that they're looking for? And how can we actually attract grants? Things like that. Yes.
Okay. Right. Thank you, Dr. Dujiba. I just look at the chat again. There is another question. Also, there's someone also Hassan, right? Already share another website for I think for the game community. So please check on that. I just checked quickly. I didn't see the detail yet, but please check into that. And I just followed to see another question. Oh, here's another question. So how do we incorporate gamify learning in the current Canvas IMS for baby step to start off? You think it's possible?
Probably there's another person who is here who have used it because I have never used Canvas.
Maybe I can share.
Okay.
So am I allowed to share screen?
Yes, you can.
Okay, so
please go ahead.
So this is one of the. Can you see the interface? Yeah. So just created one assessment on. It is an assessment format, but it's a case study. So if I can restart. So can you hear?
Yes,
I can see it. We can see it.
We can see and we can hear.
So this is the one which I was talking about.
Actually not hearing. I can't.
Oh, sorry, can't hear.
Right.
Can't hear.
Oh yeah, the sound there. You need to share sound. I do not share.
I did actually. So no, just to give an example that this is a very basic case study which we have actually created, and this is incorporated in the Canvas, as you can see. So it is just to, the question which was raised about whether we can do it or not. Yeah, it is possible actually to incorporate the case study and the gamification into. So it's not just so much of I mean, it's a very baby step, as I was telling Dr. Dujipa in the beginning. Doesn't have levels. It doesn't have this thing, but it's a very basic thing, to start with. And I want to add on to this, as Dr. Dujipa had shared, and also add analytics to it. So what I'm trying to say is it is possible that we can use this thing, and then we have the analytics, the new analytics which came up. And if I look into the analytics, you can see that. So through this analytics, actually, I saw that the participation went up when the gamification was uploaded. So that is the only thing I can see. But I cannot see why as I was mentioning, why some students left halfway and why some students couldn't do it. So this is the basic thing. I mean, my experience with Canvas and gamification, very, very small thing. Yeah. So
Tanushree, you use Canvas to create the game. So that's a function in there to
no.
create.
It was a different created and incorporated. So basically it integrates into, it was uploaded onto the Canvas.
So you need another
software
platform to create.
Yes.
But integration is possible.
Yes, but having said that, all platforms, they don't integrate with Canvas. We have to make sure that which one can integrate with Canvas, because as the question is raised, it's very important that students don't go to different platforms. Otherwise, they lose the interest. It's good to have a common platform. So yeah. Yeah, maybe I will stop sharing. Thank you so much.
Yeah, thank you. So probably if you may, you can share with us the platform that you use. I'll ask Shawan to put on our website. So if anyone can try
Actually,
that,
this one was I took help from Scale. Scale actually has created this. So I think they are doing lots of stuff on that. So maybe they can, you know, approach a Scale as well. So for these projects.
SCALE? Is that the website?
Yes.
SCALE.
It's our NUS.
Yeah, it's Scale is
Scale.
Adult learning.
Yeah.
Yeah.
All right.
Adult learning.
Adult
Yeah.
learning. So this is the
It's
website.
NUS. It's a unit in NUS.
I see. Okay. All right. So now I'm looking for another. Are there any question from the participant? So there's some suggestion there. There's some. Oh, here's another one. From Duchi Park. Has
I replied to that.
Oh, you replied. Okay, one. Oh, I saw that. Okay, thank you.
Yeah.
So there is something.
Some technical things. Probably Tanushree, you'll be able to answer.
Oh, I see that. Skill. So for all of this sharing, I'll ask Siobhan to keep those website, and then we can post, this link to our community website, so anyone who interested can go there and check the information. How about that?
That's great. Yes.
Okay. Any questions?
Yeah, I think we have covered all those questions.
Yeah, cover all the questions.
Let me check with I have incorporated most of the questions that.
Yeah, you do. You did.
Yeah.
Wonderfully in one lecture, one talk.
I tried as much as possible to incorporate. Someone has asked for a lot of evidence behind, whether this is useful or not. So the ones that I have read, and then also I shared about the conference proceedings. I will probably share it with Siobhan and Tanushree and Piani, so you can send it out and they can access those references.
Please.
Yeah, most of the things we have just discussed.
I think that the one question regarding the ethics, anyone asked, and I'm not sure if you addressed that, but there's one question asking that was the question sent earlier before the session, asking like, are there any situation that you think it would be an issue with the ethics when using the gamification?
Yeah, so the ethics and also the data, and I kind of covered it under the data security, etc. So ethical issues is when we do if we have a lot of planned gaming along in our course, we actually get a lot of insights about the student, right? What their capabilities, what their gaps, what their preferences, whom they can interact. So that is actually, especially the behavioral analytics that comes with the overall performance analytics. The behavioral part, the system collects, right? When the person is actually gaming, and sometimes what time of the day that they are active most, what time of the day that they are not active most, and if the game actually gets what their preferences are, right? By the use of avatars, how they personalize their avatars, etc. All that is captured. So that's why it is so powerful system. And even without us knowing, these elements, these behavioral analytics are captured by every time we go to Facebook, every time we ask Google questions, every time we use our LinkedIn. All this information is captured by those vendors, right? Now the ethical part comes in if we then use this information without the consent, right?
Correct.
Without the consent of the student or the program coordinator or the institution, etc., for different gains, right? So that's where that you need to be very careful. And I just want to share that there's a couple of organizations coming together, and I feel I'm very privileged because they asked me also to be in that. With AAMC, that is the American Association of Medical Colleges, which has a huge, all the medical schools in North America are part of this organization. So AAMC, IAMC, that is International Association of Medical Science Educators, AME, that is the Association for Medical Education for Europe, and the Asia Pacific Network, which is Asia Pacific Medical Education Conference, that is anchored by Asia Pacific Medical Educator Network, APME-NET. We are actually working together to come out with certain guidelines with regard to the use of generative AI, adaptive learning, collection of, use of games and collection of these information. What are the guidelines so that individual institutions, programs can develop their own guidelines with regard to ethics, with regard to professional use of such data, etc. So that's where the ethical component comes in. And even worse, if our systems are very vulnerable, if someone can hack into it and capture all this data and then publish it on
correct.
The black web, dark web, then of course that's going to create a lot of problems.
Yeah, so thank you to bringing up a very, very important point. So let's say if the information from the classroom and then produce, we collect data from students regarding the feedbacks or whatever, and with using that data, if we like to publish it, is it fair to say that we need to seek ethic approval? So
Absolutely.
I mean,
Absolutely.
Okay.
Yeah, I mean that's without saying. So anything, if you're, so this is the other thing probably I think we really need to think through. If you're designing something, a lot of thought goes in, a lot of resources goes in, a lot of our time goes in. So when you're doing it, look at design it in a way that you can publish it. You can actually publish and share this data. So put in an IRP application and kind of, cover it. So don't forget that part. And very often we do everything. And when we start, the analytics comes in and say, oh, this is something good that we want to publish. But then we haven't got the IRB approval. And when we apply for IRB, they say, sorry, we can't give you because we didn't get the approval earlier, right? So you need to think of those areas as well. Right? How I think that's important.
Very important. We can't do retrospectively, right? We have to do prospective.
Most of the IRBs don't approve retrospective data, but unless if it is program evaluation data, then I think you have a slight chance of getting it through. But otherwise, they don't like it and they don't approve.
Gotcha. Yeah. All right. So let's I'm aware of the time. So let's look at the question again. There's seem like there's a recording. All right. So there's some question regarding, seem like there's no more question, but only one question regarding the recording. Okay, I can respond to that. So this session is recorded with permission with Dr. Tujiba to post on the website, and we can do the, you give us permission, am I correct?
Yes.
Do we get your permission? Okay, thank you so much. Then in that case, we can post the recorded video to our own website and Instagram and YouTube channel. So probably, Shawan, if I ask your help, may I ask your help to maybe share the QR code that we can, go to the website. Right, so there are, I hope you can see it. So there are, so thank you, Shawan, for your hard work on this. So she helped us create the website. So the QR code from the website, NUS AI Health Community website, and also Instagram, and also we have a YouTube channel. So you can click the link from the website as well. Okay, so that I hope you get those.
So, Piani, before we
Yes.
go, I
Okay.
want to share two things. First of all, I want to thank all of you, especially the Piani, Tanshri, and the colleagues for giving me this opportunity. But now I'm also, as you can see, very excited with this group and the work that you do. So I want to know what would be the next session and when that would be. Yes, thank you very much.
Oh.
Thank you all.
Oh, that's good. Thank you for that. So the next session we try to get Professor, I think Chintaka from Australia. So the topic, I'm not sure about topic. Shawan, will you recognize? Right.
It's already there in the,
right. Is it there? Okay.
Yeah,
Oh, here we go.
Oh, yes.
Sorry,
it's already
my
in the
eyes,
website.
yes. Yes. Yeah, thank you for that. My eyes read. Human AI partnership. So that'll be in July, 31st of July, and in August and September, we try to get to speakers who have experience in using the AI and to kind of like assist with the assessment system. So we have two speakers. One person in August would be more like conceptualization, and then for the September, we have someone who do the hands-on to kind of like help us, because I think assessment also a big issue among us with the large, large data on assignment and number of assignments. So I think maybe we can explore the possibility and the timetable that for the next webinar also will be posted on the website as well after we confirm the speakers. So thank you, Dr. Tujiba, for asking
Thank you
that
very
question.
much.
Yeah.
Have
All right.
a
So
good day.
on behalf of the NUS AI Health community, we are thankful for you to give such a wonderful and detailed presentation. Thank you very much. I hope you continue to support us on this community. Thank you very much. Okay.
Thank you.
Thank you.
Take care, everyone.
Thank you.
Thank you.
Bye-bye. Have a good day,
Thank you.
everyone from different part of the world. Bye-bye, our partner.
There is a message from Dr. Hassan.
Oh, okay.
He wants the invite for the next webinar.
All right.
So actually, yeah. So I think they can click
Register.
to the link.
Yeah.
The link
And
sent
register
earlier.
similar to this one, right?
Yeah. So
yes. We use the same link. We use the same link across the webinar, and the webinar would be posted on the website. Yep. Yeah. So the next one on July, we use the same link, Zoom link as well.
I think Dr. Hassanan, you are not from NUS, if I'm not wrong, right? Are you from NUS? Dr. Hassanan?
Dr. Hassanan.
Are you there? I think he left already.
He left already. Yeah.
Okay.
Oh, no,
okay.
he said no.
No, he's not.
So
he's not.
So Dr. Hassan, there is a link shared by our RA. You can actually click onto the link and you will get all the updates of this health community. And we can collaborate further on, I earlier I saw you share the link for another healthcare community.
Yeah, he does. He did for multiple websites. Thank you so much, Doctor, for that.
Thank you so much. Thank you. Yeah.
Okay.
All right.
All right. Thank you.
Yes. Thank you, Dr. Tujuba. Have a wonderful day.
Thank you, everyone.
Okay, bye-bye.
Bye.
Thank you so much. Bye-bye. Our partner. I'd like to say hi to you before we leave. How are you?
I'm good. How are you, Piani?
I'm okay.
Nice to
I miss
see
you.
you
Yeah,
all.
nice to see you. I miss you. I missed you so much. Thank you for joining. So would you like to, hopefully you can join the next session as well. So we can, we can still keep in touch.
Yes.
All right. So have a wonderful day over there. Okay. Bye-bye.
Yes.
Bye-bye.
Have a good day. Bye-bye.